One more interesting topic that we will just see is a kind of a Roux-en-Y bypass. Here what happens is the physician, he is going to treat the patient's morbid obesity via creating a new stomach. What happens here is the stomach, the major portion of the stomach will be left, and now the physician is going to create a new stomach. And from that new stomach, what happens is a pouch, a kind of a vertical pouch is being created. I think you can see the pouch over here. And then the duodenal or the bowel segment, now this becomes redundant. They are not going to make use of this. Now, can you see a Y-shaped structure forming from the new stomach that is being created? So this proximal pouch is called as the afferent limb. As a result of gastrojejunostyomy, what happens is because of some pressure variations, patient develops nausea and kind of vomiting. That is called as afferent loop syndrome. Here, coming back to this old ERCP, now via this ERCP, they can also do a procedure called as Fundoplasty or a Nissen Fundoplasty. While treating conditions like diaphragmatic hernia or paraesophageal hernia, what happens is the fundus of the esophagus moves into the diaphragm and it enters the thoracic cavity. At that time, the physician is going to do a kind of a folding called as fundoplication. He folds it and then he ties his fundus to that of the diaphragm. So that is called as a fundoplication. So you can also do these procedures endoscopically.